Hafa everybody, I'm Sabrina Salas-Matanani, and welcome to our Health, Home, and Lifestyle edition of KUAM News Extra. We start with public health's efforts to prevent the spread of dengue fever on Guam after there has been one confirmed local case. In Health Check, we hear from Acting Public Health Division of Environmental Health Supervisor Jerome Garcia.
Health Check is presented by Island Cancer Center.
Our operations, so when we do receive a local confirmed case of dengue, our team, all hands on deck again, we would conduct surveillance and control around the target area. We would conduct a 200 meter radius spread and canvass all the surrounding homes and buildings and residences in that area, provide them education. So we do give out pamphlets on how to protect yourself from mosquito bites, information about dengue fever, as well as collect samples for identification and rearing. So that would include using our aspirators to catch adult mosquitoes, whether it's manually or through our battery-powered aspirators. So they're essentially, vacuums that you would suck up adult mosquitoes, or also through collecting larva samples. So we would get these, big turkey basters and check for sources of breeding, and that's usually in a lot of containers that hold water. So we've caught a couple, we found a couple. They're in our lab being raised right now for identification. So that's as far as the surveillance and outreach goes. And at the same time, of course, we asked permission if we could set our mosquito traps, and that way we can see just how widespread or how far these mosquitoes are able to go. The best way to prevent yourself from getting dengue or from getting bit is to use preventative measures such as using, the mosquito repellent. As long as they have the appropriate active ingredients, then they should be sufficient enough to protect yourself from getting bit. Yeah.
Do you guys have any tips? Like, what is that one they say? Oh, wear this type of color clothing.
Yeah. So as far as clothing, if you spend a lot of time outdoors, of course you want to cover up. So long, loose-fitting clothing is fine. But mosquitoes are more attracted to a dark colored material. So if you're wearing black or brown, they're more attracted to those colors. They're more attracted to the CO2 emissions. So if you give off a lot of CO2, you'll tend to notice you get bit more. So those two factors, along with heat, would make you a prime candidate to be bit by mosquitoes. So if you're outdoors, you can wear long sleeve clothing, apply mosquito repellent, make sure it's light colored, that helps your chances from getting bit. But again, the best thing to do is, to take preventative measures. So not only using mosquito repellent or wearing long, loose-fitting clothing, dumping out mosquito sources of breeding. So any water containers, plants that hold water, you can flush them out. Any, pet dishes or toys, all those are prime places for mosquitoes to breed, especially the type that may potentially, be the vector for transmitting dengue. I'm not too sure of the origin. It may be here. People may be symptomatic, so they don't show. But essentially, the way mosquito transmission works for mosquito-borne disease to go from person to person is that the person would already have to have the virus in their blood. The mosquito would then feed on that person. The mosquito would then get the bacteria or the virus into their system. It would take a couple of days for that to go from their proboscis to their gut. And then finally, that mosquito would bite other people, therefore transferring the virus or bacteria from them to other people. So that's pretty much the route of mosquito transmission for mosquito-borne diseases. As far as its origin, I don't know, it could be here, but that's essentially how mosquito transmission for diseases works. Fortunately, we're lucky that it's still one case. It's not declared an outbreak yet, but we are treating it as such. So, we are utilizing all our manpower to ensure that the spread of, dengue is not going to happen. So all our staff is going out there to do education, to do outreach. We're calling people to, let them know that we are spraying. So we are applying insecticide, adulticide for adult mosquitoes and larvicide for those still in their larval and pupal form to sort of like nip it in the bud, just to knock them down right at the start so it doesn't get any worse.
Stay tuned. Health, Home, and Lifestyle continues after the break.
At Island Cancer Center, we treat our patients and their families like our family. We have all been touched by cancer, and it is important to feel comfortable and secure under the care of our health professionals. You can count on us for skilled cancer specialists, the most advanced cancer-fighting technology on the island, and a commitment to caring for you or your loved one with compassion, respect, and empathy. Our family, treating your family.
Island Cancer Center, located on Guam Medical Plaza. Visit us at islandcancercenter.com or call 646-3363.
Half a day.
Hi,